Welcome back. February is American Heart Month, and there are new guidelines for taking medicine that lowers your cholesterol. Joining us today is Dr. Amina Haji, a primary care physician in family medicine at Scott & White Pflugerville, to explain some of the new guidelines. Thank you for joining us this afternoon.
Thanks for having me.
So what are these new guidelines?
Well, so there's guidelines that are put out by the American Heart Association and National Heart, Lung, and Blood Institute and the American Cardiology Association that redefines the groups that should receive cholesterol-lowering therapy for both preventing and treating heart disease. What it essentially is that it now expands the group of people that should be on a class of drugs called statins, which is a popular category: Lipitor, atorvastatin, Pravachol, these drugs. It reduces the different number of medications that are sort of a first line and says usually start with a statin, and then it adds people that should receive it to what it used to be. So those specifics are now anybody with diabetes is recommended to be on a statin automatically. Anybody that's middle-aged and has a cholesterol, LDL, the bad cholesterol, of 170 or higher, a very high LDL, should automatically be on one. And then there's a new risk calculator for your risk of coronary vascular disease, and that would be anybody with that risk of 7.5% or higher that's middle-aged should be on a statin.
So the number of groups is expanding, but the types of drugs that they're prescribing are narrowing.
That's a good summary.
Right there. Are there any concerns out there with these medicines that lower your cholesterol?
I would say yes. I would say yes. You know, I think in general these medications, they've been around a fairly good amount of time, but if you look at it in the big picture, they're all relatively new, maybe last 40, 50 years. They can have effects. Of course, some people have heard about myalgias. They can cause some muscle breakdown. Some can cause liver inflammation. A person just needs to be aware of these signs and symptoms of the side effects or an intolerance, so you can report to medical professional. And
very quickly, if we were to bullet point certain things to just to better your heart health, what would they be? So
I'm really excited that you asked that question because I feel that's far more important than statins and these guidelines, which I think are a little bit narrow and focus on drugs.
You want to be preventative, right?
You want to be preventative, and even people forget atherosclerotic, meaning heart disease with plaques in your blood vessels causing heart attacks or strokes. It is reversible even if you have it. And the basic things are an anti-inflammatory diet and lifestyle. So anti-inflammatory diet. There's a great book, if anybody's interested in this, called Food Rules by Michael Pollan. Basically, he says nothing in a package, nothing with ingredients you don't recognize. So ultimately what this means is fresh fruits and vegetables, whole grains, for instance, cracked wheat, quinoa, brown rice, not white rice, all these whole grains, and organic when you can. And all of these things reduce inflammation in our body in general. Inflammation plays a big role in heart disease. And the other things that go along with lifestyle is getting exercise. That's a fundamental. There is mental and spiritual health. So mental health means if you have stress, running around from place to place, if you have negative emotions, anger, all of these things promote inflammation in our body, and that leads to heart disease. But so my line is, heart health doesn't come in a pill or a package.
There you go.
That's a hard one.
It's a lifestyle.
It's a lifestyle.
Thank you. Dr. Amina Haji. Appreciate you being here.
Thank you very much.
All right.